Hi, Amy. Thank you for joining us on International Women's Day. It's so exciting to have you back. You were previously on the On Call podcast where you did an absolutely fantastic episode on long COVID. And today we're going to be talking again about COVID and long COVID specifically and how it might affect women and women doctors. So, just to get us started, I'm wondering if you can share with us what long COVID actually is and maybe some of the experiences that you've had with it.
Okay. So the definition of long COVID is anyone that has symptoms after 12 weeks of having had an acute COVID infection. Although I think we know that probably we ought to start recognising it a bit earlier than that, because there are interventions that can help people when it is diagnosed earlier, if we think it's kind of heading that way. I think many people are affected with fatigue. Fatigue is a huge factor. And also something called post-exertional malaise, where you get really tired after you've exerted yourself in one way or another. Lots of people are complaining of breathlessness, headaches, tinnitus, loss of smell. There are people having ongoing chest pains, even some people having neurological problems, people who can't walk properly as a result, numbness, tingling. I mean, there's a whole host of different things. I was mostly affected with severe fatigue, post-exertional malaise, breathlessness, and headaches. Those are things that particularly affected me with long COVID.
Well, I hope that you're on the road to recovery. It seems like a really, really difficult condition to have. And we're really grateful for you to come along and share more about that with us. So you've said that symptoms after 12 weeks is where we would then consider something to be long COVID. But how long have people been experiencing symptoms? How long can long COVID be?
So I think we're seeing people that caught long COVID early on in the pandemic have now been having symptoms for over a year. So, we're seeing a lot of coronaversaries on social media, Twitter, Facebook, people who are still having issues, people who still can't work, still can't function normally day-to-day life. So yes, we don't know how long it's going to last. I think, we're trying to learn lessons from previous outbreaks. So the previous SARS epidemic, some people were ill for 2 to 3 years. I think there are some probably who still are ill. So I think it depends on the particular nature of someone's long COVID. Some people are getting ME or chronic fatigue syndrome diagnoses. So I think time and research will tell how long this is going to last for.
Absolutely. I certainly hope that there is an end in sight for those patients. When we're talking about women and COVID and long COVID, with those symptoms, is there ways that women experience them a little bit differently? Or is there changes in the way that women are experiencing COVID and long COVID?
So I think it's a really interesting question, because I think there's a few facets to that. One, we're seeing that a lot more women are reporting long COVID symptoms than men. And we don't know how much of that is just that women are more comfortable in presenting with medical complaints. We're used to, as women, having been regularly seen by doctors for contraception, pregnancy, our children, etc. So I think we're generally more comfortable with seeking medical help or advice. We know that women are probably more comfortable on social media and in peer groups in terms of reporting again these things. So we think that's why there's a higher prevalence of women. However, we do know that COVID is affecting women differently, in the sense that a lot of women are reporting problems with their periods. That when they get their periods, they're having relapses, or their fatigue is extreme, or their period symptoms are a lot worse than they were in the past. And we also are seeing that women who are perimenopausal or menopausal also are having problems. So I think this is why women in particular are having these issues that, of course, men aren't going to experience in the same way. They have their own issues that we don't have, but this is something that women are seeing a lot more of.
I suppose you've then answered some of my next question and gone into it a little bit more, but I wonder if we can talk in a little bit more detail. Women over 40, it seems, are in that menopausal stage of life, seem to be more at risk of long COVID. But as you've said, that also can be due to cultural factors around being more willing to share those symptoms with medical professionals. Do we have any idea of what the clinical basis for that might be, or is it still just kind of one of those things that we've just observed at this stage?
Well, when you sent me the question, I had a rummage and ask of some colleagues who probably know more about this than I do. And from what my understanding is that our ovaries and the pituitary gland, which regulate our hormones in our brain, they have large numbers of acetylcholine 2 receptors. And it's believed that COVID affects the pathway in which acetylcholine works in our body. So I think the current thinking is that for some women, particularly perimenopausal women, COVID can tip them into the menopause because it affects that pathway. So some women have been trialing HRT and have felt a lot better, particularly when they've had added testosterone put into that, which we know can also be really helpful for women who are menopausal. So I'm hoping that more research will be done on this so we can find out more about it. But I think that's something probably quite mindful of, or clinicians to be mindful of, is that if they're seeing women who are having particular problems with this, to think, well, actually, is there any harm in trying a bit of HRT to see if they might feel a bit better?
That's absolutely fascinating. I actually didn't know any of that. Obviously, at BMA, we're not medical professionals, so things like this are always really, really interesting to learn about. For those women that are dealing with COVID or long COVID, what kind of advice do you have for them about how to deal with that?
Oh, there's so many different things to factor in. I think, interestingly, I was reading today that the antibody test is more sensitive in men than in women. So just as we know that the COVID test that we do initially when we're ill has only a 70% hit rate, so there'll be 30% of people will have false negatives. Apparently that's the same for the antibody test. About 30% of people will also have false negatives if they're women with the antibody test. Now, this can mean that people might not be believed. You know, they may have had COVID prior to general mass testing, so they might not have had a test. If they had a test, it might have come back negative. So then go on to have an antibody test that then comes back negative again. So again, I guess it's really difficult for those women who, you know, genuinely think all their symptoms are linked to long COVID. You know, trying to be believed can be quite challenging. So I guess as we do more research into that, you know, women can also say, look, actually, maybe it's just because I'm a woman that the test doesn't come back positive, that we mustn't ignore their symptoms or the signs of their illness based on that. I think there's also just a bigger thing around, you know, domestic burden, and we know that that women tend to carry a lot more of the domestic burden at home. So in families, tend to do more of the food preparation, house cleaning, etc. I think I'm really lucky that in some ways that both my husband and I had long COVID. Because I think we were both ill at the same time. We both had kids who weren't able to go to school, who weren't able to go to nursery. We were really sick, having to look after them, but we were both ill. I think if one of us had gone back to work and was feeling fine, and the other one was at home having to deal with the kids all day long whilst being ill, and then also have to do all the other stuff, that's where it's really challenging. And I'm seeing that with colleagues and friends who are having to do the childcare because there isn't any childcare available at the moment because of the pandemic. They're sick, they can't recover, they can't recuperate. And I think that's where we've really got to look at, how do we manage our household together? You know, how do we as families, couples, individuals, how do we manage things? You know, so allowing ourselves to take a break, you know, allowing ourselves to say, okay, you know, it's okay if I don't clean this or I don't hoover this, or if I have the means, it's okay when it's allowed to pay someone else to do that. You know, I think it's really trying to make sure that everyone in the household is aware of what's going on, that, you know, duties are very, you know, that we plan and that we pace and organize our day around being able to rest and recuperate fully. Because if we can't rest and recuperate, we're not going to get better, and it's just going to be stuck in this vicious cycle. And I think that's the thing that's, I think, been really challenging for people, and where women have been affected, that these are some of the things that, you know, they're reporting that they're finding really, really, really difficult at the moment.
Absolutely. And for doctors like yourself and up and down the country as well, I think there's a real keenness to get back to work as well, perhaps maybe even a little bit too soon, because you you want to be there, you want to be on the front lines helping, and you want to be, out there caring for patients. So I guess my last question then is, what advice do you have for maybe more specifically doctors or for their employers about supporting people with long COVID and making sure that their eventual return to work is successful as possible?
Yeah, I think it's really important that we really look closely at how our phased returns are done. I think that we need, really expert advice from occupational health, who should know how to help support us in this. I think we also need to remember that our phased return takes into account our domestic burden. So when we are going back to work, it's not just that we're going back to work, but it's how does that affect everything else. I remember when I went back to work, prior to going back to work, I was told I needed to be functioning normally for 2 weeks prior to returning. So I got to that point and I started my phased return, but of course then I'm working, so I'm exhausted in the evenings. And so I was trying to have to sort of explain to my family, well, okay, yeah, mummy was able to do this previously, but now isn't. But I need to work because we need the income. So it's just trying to find that balance. So I think, phased returns need to take into account, every aspect of our life, not just the work aspect and how that affects us. I think it's also important that employers look at what people can do and not focus on what they can't. This is a small blip in a long career, that we have. And if we can really look, and it might feel like a lot, and I know particularly in small GP partnerships, etc., having a man down is really, really challenging. But actually, if you can try and help support your colleagues through the next 6, 12, 18 months, then you're going to have someone who can be there for the rest of their career and hopefully be flourishing. So maybe where someone couldn't do an entire clinic, actually there's a bit of paperwork that can take off your hands to allow you to do a bit of extra, face-to-face work, allowing rest breaks and full rest breaks, allowing your colleagues to have somewhere to lie down if they need to in the daytime, just to take time out for a little bit, just to help recuperate, to be stronger in order to do their day. And I think just being mindful that we know that during COVID, a disproportionate number of women have dropped out of the workforce, and we just need to be really careful with this. This doesn't, inadvertently, adversely affect women, because actually I'm seeing now that people are either being forced to resign, being sacked, or having to look at what they can do work-wise because of this illness. And really, if we can help support them the best way, if we can keep them in the workforce, we're far better off with them than without them. So just trying to be mindful of all those things and support as best we can.
Absolutely. I think it's so important that we keep as many doctors in the workforce as we can, and that the NHS is a supportive workplace that will embrace doctors who, unfortunately, this illness for a lot of them will be a workplace injury. It'll be something that happened through work. And I think it's important that we continue in that way of compassion that I think we've really seen come forward. Thank you for your time this afternoon, Amy. It's been such a fascinating discussion. If anyone wants to hear more, we do have a full on-call podcast episode that you can get on Spotify or iTunes. But thank you again, Amy, and I hope that you continue to get better and also continue to spread the message about long COVID and how it's affecting our doctors today.
Thank you.
Thanks.